So now I'm going to bring you up to speed on what's going on with therapy. We're about to start the scary part. So I had a bunch of different homework assignments, some of which I mentioned, where I had to come up with a list of things that I avoid. Well, I also compiled a separate list of things that I relive on a regular basis, and there is definitely a separate list. And I don't completely understand why some things you avoid and some things you relive. But I have those two lists, and the first list of things that I avoid, we came up with ways to kind of slowly, in bite-sized pieces, kind of face those things. And those are homework, because they're places and people and things outside of therapy, and I'm going to go and do them just one at a time, carefully, and practice my skills on my own as homework. The second list of things that I relive on a regular basis that are very traumatic for me, these things we're going to go through in therapy, and what we're going to use is Imaginal therapy, which is what it sounds like, kind of, Imaginal. I'm going to go through the event in detail and pretend like I'm there with my therapist. For me, these are things that were mostly done to me by other people, and they represent the worst things that were done to me by other people. And so having to drag all that stuff out and, examine it in tiny detail with somebody else is going to be extremely painful, and because of the PTSD, it's also going to be scary. But the idea is to face these things, to take them out and to examine them in detail, and first of all to realize that I can think about these things and examine these things without dying. Some of it is just exposure to the fear and, oh, okay, that wasn't as bad as I thought it would be, But the other idea is to kind of make sense of it. And this is something that all people need to do with things that are bad that happen to them, and should happen naturally, kind of, after the fact, especially if you're dealing with any kind of grief. You go through a period where you're trying to make sense of it. Why did this happen? Or, how can I explain it? How can I explain this within the framework of my beliefs, my faith, maybe? For instance, if somebody dies, you might say, oh, well, they're in a better place now. Or you might not. You might say, no, their death was pointless and life is cruel and meaningless. But, and this is, this is the sense that I've made out of it. Either way, making sense of it in your mind is a really important part of kind of putting it away and moving past it. And this is something that I was not able to do because of the fear and trauma associated with it. I never moved past it. I'm just stuck reliving it over and over and over again. I never made sense of it. And so that's what we're going to do. We're going to go through it in detail. We're going to make as much sense as can be made of these things, and then I'm going to put them to rest. So it's really scary, but I understand why it's so important. And after going through kind of all the prep work, and I think I mentioned how this has triggered kind of a mourning in me, I'm ready for this, this kind of closure. I'm still going through kind of this grief process, and I can see this as a natural next step to the grieving process. And so I'm excited to do it, and I'm also really scared. And that's what I'm doing tomorrow. One little surprise, my therapist chose not to tell me, which I know she did on purpose. She had me we came up with a list of all the various things that we were going to do, and there's about 7 of them. And for my homework last week, she had me rank them from hardest to easiest. And of course, naturally, I was thinking, okay, we'll start with the easy one, you know. And I get to my appointment, and we go through the list, and I tell her what the order is, you know, this is my homework, and and she gets it all straight in her notes, and then she goes, okay, well, we're going to start with the hardest one first. And then she went on to explain to me why this makes sense. First of all, you don't want it to be kind of looming, because the thing is, you know, if you start with the easy one, you'll be like, oh, well, I managed the easy one, but could I still, you know, could I really do the hardest one? So that's part of it. The other thing is that sometimes once you get the first couple out of the way, everything else sort of falls into place, and you don't really need to do the last couple. So I understand why it was done, and I understand her explanation for why it's a good idea, but, you know, that was kind of a unfriendly surprise. Because really the hardest couple on my list are the only ones that I'm still not quite sure if I can do it, which is probably good. You know, I'm being challenged, and that's kind of the point. But I am really scared. And we talked about what's going to happen in therapy tomorrow, last week, and we're not going to jump right into it. We're going to do what my therapist calls the bookends. So we're going to talk about what was happening right before the event, what was happening directly after the event, when I was safe again, and then we're going to talk just basic details, but not really get into it. So that's what we're going to do tomorrow. And then I assume we'll get more in depth the next week. So, you know, it's not that bad. I can handle it. I'm allowed to bring one object for comfort. So a teddy bear, a pillow, a blanket. Some people bring things that smell nice. Aromatherapy, kind of. I haven't decided if I'm going to bring anything, and if I do, what. The only thing I'm not allowed to do is dissociate, which is when you kind of go to your happy place and you're not really present in the moment anymore. So if I start to do that, she'll make me do things that bring me back. So push-ups. She has a balance ball that you have to sit on because it forces you to kind of stay in the moment. Or some other kind of sensory stimulation to kind of keep you in that moment. So I'm not allowed to run away in my head, which I'd really like to do right now. This week has been a lot tougher just in my private life, not really wanting to be around other people and having a lot less inclination to be nice to them. I don't have the same patience with people that I normally do. I'm just angry and scared and hurt, and it's so much more intense this week because I know what's coming up. So trying to kind of deal with that is also part of therapy, learning to, you know, not take it out on other people and not allow my whole life to be just a mess just because of what's going on. And radical acceptance kind of ties into that. It's helping me a lot with that, where I'm saying, yes, I am in pain. I feel terrible inside all the time. I'm scared, but I'm not going to take this out on my family. And I'm not going to take this out on the customers at work. And I'm not going to allow this to ruin my life, you know. I'm not going to lose my job because I'm being nuts at work, you know. I'm going to keep it under control. And so that's also been kind of a learning experience, I would say. So that's where we're at. I will definitely let you know how it goes after tomorrow. But here we go. It's getting real. It's real now. I know that I'm going to make it through this. I know that I'm going to succeed. But that doesn't make it any less sucky and scary. So